Hello. We're going to talk today about how to do a hip flexor stretch. So if you notice you're having pain in the hip flexors all the way down to the quads, hip flexors right through here, all the way down to the quads. If you're experiencing anterior pain in your hip, then this will be a good stretch for you. This stretch is very specific in the order in which you want to do it. If you don't do it in the proper order, you'll feel the stretch in other places. So let's get into it. Hip flexor stretch. We're gonna lay down. Make sure you're on a bed or couch, something you can hang the leg over. This will not work on the floor. You're gonna scoot your hips to the edge. You can keep your shoulders over the opposite way for a counterbalance. And what you're gonna do is take the opposite hip, which is the one inside the bed. You're gonna pull it up, hold under the knee. A lot of times people, and I'm gonna show you on this side, a lot of times people hold on top of the knee. This is putting extra torque and pressure on the kneecap. We don't wanna do that. So always hold under the knee, pulling when you pull into your chest. All right, so on this leg, we're gonna hold under the knee, pull into the chest, and you can see when I pull into the chest, my hips rotate posteriorly, right? So when I pull in, that's locking me back into posterior rotation or posterior tilt of the pelvis. All right, so we're gonna hold the knee in, take the other leg and drop it off. As you can see, my hip flexors are tight because you can see space in between the bed and my knee. Ideally, and I'm gonna relax, ideally we should be here with our hip flexors, but you can see how my back arches, the hips go into anterior tilt, and that isn't what we want. All right, so knee into the chest, pull it in, lock it in nice and tight, bring the other leg off and let it hang. And you will feel this stretch right through here, hip flexor, iliopsoas. If you want to feel more, bring your heel closer to your bottom and you'll feel a little bit more of a stretch. But if you already at this height, if your leg is not on the table, don't worry about bringing it out. You'll get enough of a stretch right here. We're going to repeat that on the other side. So again, we turn. Our hips are going to be over. Chest, head in towards the middle. Opposite knee, pull into the chest. Hold it really tight. Remember to start with both knees flexed, hips and knees flexed. Pull it in really tight, lock it in, take that leg and drop it off of the table. You'll feel a nice stretch in through here. And we just want to hold it. Each stretch we want to hold for a minimum of 30 seconds. The longer you hold it, the more change you'll have in the muscle tissue and the muscle length, which means less spasm, less pain overall. So, thanks. See you next time.